Lawmakers got some unexpected news in the final weeks of the session regarding the state health plan. They assumed that plan was millions of dollars in surplus, when instead the health plan faces a possible $250 million deficit. House and Senate Democrats adjourned the short session without agreeing on a remedy. The state health plan faces a 9-figure deficit after the House and Senate could not agree on emergency funding before adjourning last week. The health plan is not currently in any deficit. It's just scheduled to enter the red early in 2009, possibly during the next legislative session. That's if projections hold.
For the 2008-2009 fiscal year, that we're looking at the state health plan running a deficit of somewhere around $250 million.
The plan is estimated to be down to a $20 million reserve by December. The plan spends $10 million a day. So when you have a $20 million reserve, you have a 2-day reserve. If it hiccups, we are busted. If we were a commercial plan, we would be insolvent.
The Republicans say Democratic leaders should have known more, at least suspected more, about the state health plan's impending deficit before writing and passing a budget, then adjourning.
There was a scent of this starting in January when the actuarial report came in about the utilization and the cost, a stronger scent in February, and then when the March report was due and it didn't come in, and then the chief financial officer resigns a few weeks later, and then there's just been a whole snowballing effect that's been going on since January in the state health plan.
Democratic leaders say they use projections given to them by the state health plan's administrators. Those projections assume tens of millions of dollars in surplus.
Throughout the budget, the preparation of the budget, we were told consistently to expect a $50 million positive. So we were certainly not told anything other than that.
House Speaker Joe Hackney says state health plan administrators are keeping lawmakers abreast on immediate cash flow and up-to-date projections. That $250 million deficit is itself only a projection at this point.
I think that it's very manageable. First of all, we don't know the extent of it yet. We're on top of it. We're monitoring it on a weekly basis, and I think the information flow is now excellent coming from over there to us.
Republican leaders want state agency budgets trimmed by 1%, saying the newly passed budget bill could have been tweaked because the new money it's providing to agencies has not been spent yet.
That's 1 penny on a dollar. And when you do a reversion of 1 penny on the dollar and you're able to do it this early in the fiscal year, the impact on that is a lot less than it will be if we wait till after the election to deal with this.
Senate Democrats offered to raise the co-payments on nearly all health services provided under the state health plan except generic drug prescriptions.
It is estimated without this next year, the premium increase will be somewhere between 32 and 36%. Without this. Now this will get it down to the 20s, I think.
The House rejected higher co-payments. The Senate rejected the House proposal to tap the state's rainy day fund that would have guaranteed the state health plan stay in surplus until the 2009 legislature convenes. The result is a stalemate. It means no action was taken this summer.
It isn't likely that they're going to run out of money or anywhere close to it before we get back into session. So I don't think it's a big problem that we didn't provide a temporary fix.
Ultimately, the state budget is going to be responsible for funding the health plan for the employees, and the state, as an employer, has certain obligations to keep its promises. And so, for the majority party to treat this big a problem in this way is just totally irresponsible.
Lawmakers say the governor has discretion to act on the state health plan's behalf if the situation turns worse than projected. A more dire financial turn could also require a special legislative session later this year.